Hey, hot mamas, how you doing? This is Betty Vargas from Crazy Sexy Menopause, and we're here to teach women how to live more vibrantly through mindset, meals, and movement. And today, we have a great guest for you today. Her name is Phyllis Nunn. And Phyllis is an amazing therapist and author, international speaker, author. She's just I'm going to leave her information in the bio for you or in the description, so you can see all of the beautiful things that she has done. And I'll also have her website and all of her contact information in the description after this session. But let's get into it, because I don't want to just let a minute go by without letting you know how fabulous this woman is and how knowledgeable she is about the lymphatic system, about lymphatic drainage, and craniosacral massage. Let me share that I met this beautiful lady at my competition. I was walking down the hallway, and she saw me, and she was like, "Who are you? Where did you come from?" And I was like, But she was attending this amazing seminar that was attached to the bodybuilding competition that I was in, and we became. She was so enamored with me. She wanted to do a Facebook Live right there on the spot, which she did. And I was like, this is somebody I need to know. And then when she told me about what she did, I was like, now this is a person my audience needs to know. And so that is why we are here. And Phyllis, I am so grateful and so blessed to have you today. How in the world are you?
I am doing phenomenally well today, and thank you so much, Betty, for having me. You've been such a joy coming into my life the way that you have, an inspiration to me and a lot of the some of my friends on Facebook and LinkedIn who have enjoyed watching that one particular video of you strutting your stuff across the stage. And when you told me your age and when I looked at your stature and your presence, I thought there are so many women that really need to see this. And
Mm.
glad that I kind of walked into your life at that moment when I did. And it's just been a joy just knowing that you're in my little pocket right now and I have something to work towards.
Yes, yes, yes. It's a blessing for us to be here together. And what I want to share with, there's so much that I want to that I want to talk about. I'm excited for this conversation because, one, I was a general manager at a fitness facility, and also a licensed massage therapist. And so one of the things that one of the things that irks me about people mentioning massage is they call massage therapists masseuse. And so tell me, what is your opinion or your thoughts on massage therapist versus masseuse?
A massage therapist, and the word therapy means healing and recovery. And even
Hmm.
scripture says healing is recovery. It's not something that's instantaneous. A masseuse has a more sexual connotation attached to it. So that is not what we do. As a body worker and a medical massage therapist, I'm actually studying and will continue studying as long as I can work tissue, neuromuscular tissue, and how it interacts with the bones, how it aligns with the bones, and the nervous system, the central nervous system, and how the cerebral spinal fluid flows through the central nervous system and goes into your peripheral system. A masseuse is not going to do that type of assessment. They will not actually look at the body in a state of non homeostasis. This is what we're looking at. If you're really true to your craft, to your business model, your scope of practice. And that's another thing, too. When we take our ethics classes, I know in the state of Kentucky, every 2 years, we are ethically bound if we want to maintain our license to uphold a reputable business. And I don't know or think that masseuses can or do that. And they may not be licensed to do what we do, but the professionals that I know and I work with and the therapists that come to me for adjustments and medical manual massage, they're not looking for that.
Exactly. Thank you so much for clarifying that, because when I think about massage, I think about healing. And yes, there's some healing in the Swedish massage, which is the gentle, the gentle movement over the body and whatnot. But there's so many ways that massage can actually heal us and make us feel better, it's wherever we are on the menopause spectrum, and wherever we are in life. There's a healing property to massage, and so I'm really grateful that you made that distinction, that we cleared that up. The second thing that I wanted to share is that when I was hiring massage therapists, I had them to work on me so that I could, one, understand a lot of the different modalities, and also how their touch manifested. And so a couple of the massage therapists that I worked with were lymphatic massage therapists and also craniosacral massage therapists. And the craniosacral really intrigued me because at that time, I was suffering from migraines, menstrual migraines, as a matter of fact. And so when you mentioned that these two are your specialties, my ears really perked up. So can you talk a little bit about what lymphatic massage is, and also what craniosacral massage are? Because these are modalities that are not necessarily prevalent, and people don't understand that these are ways that they can be healed through massage. So can you speak a little bit more about that?
Sure. Craniosacral therapy is the study of the central nervous system flowing from your cranium down to your sacrum. And it has a 10-point protocol, which I studied under or at the Upledger Institute. And I'm certified in craniosacral 1 and 2. I have a certificate in it, but not gone any further with it, because I find that that's an excellent basis for actually doing the protocol. But one thing that I found, that with the 10-point protocol, there are other avenues, such as with in your central nervous system, as it gets to the peripheral, there are ways that you can feel those 7 rhythms that they teach you to look for in the body, because the body has a specific body biorhythm that it follows. So if you are identifying, or if you're familiar with identifying those rhythms, you can understand its pathology, because it has a pathology. The body is very unique in knowing where it wants to go and what it wants to do. But if you understand that and understand those rhythms and the dynamics of the rhythm, Just like you, if you feel that the nerve is trying to unwind and you're entering into the body with your energy to help it unwind the way it wants to align, which is ascending and descending. And you'll know the flow, you'll know the speed, you'll know how it needs to slow down. That will also help slow down the impulses in the brain that can cause a migraine headache, that can cause a lower back pain. Because remember, those nerves are controlling how our muscles move. And if there is a blockage anywhere and the nerve needs to proceed or is impinged, it has a firing. So you have to release it, and you can do that very calmly. Now, on with lymphatic drainage, that has also about a 7 or 8 protocol. You have to clear the different uh, there are parts of the body where the lymph nodes are stored in a compounded way, such as the cervical nodes, the axilla, or either the adrenals, and then behind your knees are the popliteal, and then the few that are at your ankles. So therefore, what you're always trying to do is use sweeping motions to bring that fluid up through the heart, because that's when it can get into the circulatory system. And the body has a sagittal line. And if you're working feet, ankles, your knees, you're trying to get to your adrenals. But I always have to clear the terminus, the your terminus first. That's where I do. I start out here clearing so that when I get to the cervicals, it has somewhere to go. So you don't want to start, say for instance, if I want to clear my knees, and I know that my feet are swollen, I don't want to start at my feet because if it comes up, well, I'm bumping into a blockage, it's going to settle right back down.
Mm.
So even when I tell people when you're rubbing, you're going to rub up. Always know your goal is to get to the heart. Your goal is to get to this terminus. And whether it's from here, it's going to come here. If it's going a highway, this highway is going from glands to gland. Now, if you've had double mastectomy, well, maybe one mastectomy, and you have glands here, I'm going to bring everything to this axilla. There's nothing here. I'll pull. And a lot of times people will see videos on YouTube or other social media. They're patting, they're tapping, they're going in circles. It's really hard. No.
Yes,
Lymph,
I was going to ask you about that because I see that, and that's not what I recognize lymphatic massage as being. So please, please, please clarify that.
and I'll just do one sample. If I am clearing my cervical, now this is my cervical spine, has 7 cervical vertebrae, and we have them right here, right up under the occiput. If my fingers very lightly, and they tell you 5 grams of pressure. Now, 5 grams of pressure might be equivalent to a nickel. Is that very hard pressure? No, because you don't want to damage anything. But if I'm bringing it around, this is a the sternocleidomastoid, sternum, clavicle, mastoid. Well, I know I'm going to go right here past a cervical node, and I'm going to go past the one behind my ear. I'm going to bring it down the cervical, SCM, sternocleidomastoid, and right, terminus, pop it. Just release it right here. Bring it down to the neck and release. You don't just go as far as the clavicle. Let's do that again. Behind your neck. And when you're draining, that's it.
And it's just nice and soft.
Nice and soft and smooth and has
Right.
spring action to it. And it's really good for taking out the wrinkles in your neck. And notice that I'm
Mm. We need to know that.
yeah, it's a springing action that helps you get the wrinkles out of your neck. And you've seen people
Okay.
going up. Well, what
Yeah.
you've done is just pulled it right back up into your face.
Oh. Oh my gosh, we learned something new. We learned something new.
Now, do you feel your ears opening up a little bit?
I do. Even with my little plugs in, I do feel it. Oh my
Yeah.
gosh.
And I would do that 10 times. Now, I like this.
Okay.
You told me a nanu nanu kind. You have what's called an auricular right in front. Those are lymph nodes too. And the thing that gets me when you're pulling down,
Mm-hmm.
when you have facelifts, people go, they cut you right in front or right behind the ear.
Right.
Look what you're cutting into. Your lymph nodes.
Oh.
Right. So no one has told me what do they do with these lymph nodes. Do they avoid them? Do they just go in front? Do they go on the earlobe behind? But there's a lot of fluid back there that can be built up. And remember, these lymph vessels, once they're cut, because you can either be cut vertically or sagittal or
Mm-hmm.
horizontal. If you're cut
Mm-hmm.
horizontal and the lymph vessels are going up, well, they're going to be roaming around trying to find its way, but they bump into the scar tissue, into the surgical line. So the same thing, these are vertical lines. Hopefully they don't, but that's something that people, when we get a little bit older, we may want to have facial plastic surgery. Ask your doctor, are you going to protect my lymph nodes in front of my ear and back of my ear? What are you going to do with that tissue? So I do this for me every day. I do my total body maybe twice a week. Now, I mean, I'm not looking like you because I'm checking out your arms. Like, pretty awesome. I got my covered up, but, but I know that I don't have a lot of knots, and lymph, an accumulation of lymph and fat can appear. Uh, the viscosity is not so hard, but it feels like it's congealed, like aloe vera that's been cut up and it's chunky.
Mm.
So that's what it feels like. But when you're
Now,
practicing
oh,
continually,
mhm.
but you have to clear the this axilla first, then you're clearing your arms.
Now, if someone has a lipoma, my understanding of a lipoma is that it's calcium deposits or fatty tissue. Is
Lipo
this
is
something? It's what?
fat.
Okay, it's fat. So now, can lymphatic drainage help that, or does that have to just be surgically removed?
Well, it depends on the severity, and also with for me, I always like to get a doctor's release, but
Mm-hmm.
more than anything, it has to do with diet too. Now, as I said, depending on how old it is and if it's crystallized, the lymph that surrounds it is so hard, it's going to take me time to break it up. Now,
Mm-hmm.
if it is a true lipoma and it has a membrane that is really tough, I'm
Mm-hmm.
not going to get through that. So I'll tell them, I'll refer them, look, if you really want this removed, and it will block the flow of lymph vessels. It will.
Aha.
Yeah, because it has to reroute itself around it.
Yeah.
If you have too much of it and you see people that people think it's cellulite, no, it could be lipoma and it just starts to expand. And as we talked about before, just like when people have BBLs, when they have a lot of fat taken out of their stomach and they have it put in the derriere, well, you wonder, why am I gaining weight? And I'm trying to eat the same way I did. You can't eat the same way you did because you just moved the fat from one place to another, and the fat cells would do what they were born to do. They're going to say, hey, I'm here, I'm getting fat. So it's just going to get fatter and fatter and fatter. And you wonder why you have a little bitty waist, and from waist up, you're small, but then
Mm.
waist down, it tends to get distorted, and maybe some people don't think it's a distortion, but long term it can have a dire effect on your body, on your health, on your organs.
And how so?
Well, if you have too much fat in your system, that can just, even belly fat, it can lead to heart disease, stroke, high blood pressure. because anything that makes the heart pump harder, it probably means that I'm not a doctor, just a disclaimer, but if your heart is forced to beat faster to pump that blood because there's so much, if the lymph has cellular debris, waste, protein, and is pumping through to get to your digestive system, then it has to work harder to push it out of your body, and it forces the liver to work harder to get it to process it into your digestive system. So if you're making your body work harder just to live, and you find that your breathing is more shallow, then you really need to see your doctor to find out what you can do to help yourself to feel better. And please don't ignore it, because that's a warning sign.
Yes, absolutely. And I talk a lot about listening to the body and knowing your body, and just paying attention to abnormalities or things that just seem a little off.
Mhm.
And absolutely looking at that, and going to your doctor and finding out about it and getting a second opinion, even, because you just never know your body. Our bodies talk to us all the time, but we have to listen, and we have to pay attention to these small things that happen within our bodies that we may just blow off as, oh, well, it'll go away. Not necessarily, because something small will eventually grow into a problem that can't be resolved as naturally as it would be if we caught it on in time. And unfortunately, that's what happens to a lot of women, because a lot of studies are not geared toward women. Women are not being tested, and we wind up dying because we didn't know what we didn't know. And
Lack of
that
knowledge.
exactly. And many of the studies for women in heart disease, well, women weren't being studied, and so the doctors were looking at symptoms for men, as for heart disease, the same as they were looking for women. Did I say that
Mhm.
right? And so they were looking at the same symptoms for women as they were for men,
Mhm.
and consequently, the women's symptoms for heart disease and for heart attack are not the same. We don't present the same. So it's indicative of a woman to really know your body, know what is happening to you, what is going on, and if there's a little twinge here or a little tick there, note it, watch it, and then if it exacerbates, get it checked out. So
And I'd also like to add to that,
yes.
uh, that many of the clients that I see, I've been the last resort, because they've been told, you're 50, you're 60 years old, get over it. It's a part of living, it's a part of the degenerative process of aging. And I find that using the lymphatic drainage in concert with cranial sacral therapy, I use those interchangeably in my sessions, because it's based on the body's needs, not mine. So every session is uniquely crafted for that particular person who comes to me. And what I find with women with menopause, brain
Hmm.
fog, and if we're clearing, all right, notice we're going to clear the cervicals, we're going to clear the lymph vessels in front of the ear and behind the ear. But because in 2017, it was discovered there are lymph vessels, capillaries in the brain. So I've even added a step to my protocol where I'm pulling from the sides of the brain using the same
Hmm.
pathway. And that is very good at clearing brain fog and migraine.
Really? Oh
Yes.
my goodness.
It's my
That.
theory. It's my theory and my hypothesis because it's not documented in my studies,
Mm-hmm.
but it's part of my research that I'm working on now. But it's very effective, and women are finding that they're thinking, the women that I treat, they're thinking more clearly. They're feeling better about themselves because they know that there's an option. And also, how we met at the no, optimal systems.
Mm-hmm.
The seminar.
Yes.
Working with
Okay.
functional medicine doctors, they will give you a different type of diagnosis versus
Mm-hmm.
your traditional doctors. So I recommend, because I did it, I recommend you get both. That can be your second opinion, because it was through a functional medicine doctor I found out I was allergic to too much green tea. And
Oh,
right, you see that promoted everywhere. It was
right.
a dire effect on my liver because I couldn't understand why. Why does it seem like I'm sluggish and yet my urine feels different? It looks different. It smells
Mm-hmm.
different. It was an excessive amount because I was
Wow.
reading and seeing everything on social media, and well, green tea is good. Yeah,
Right,
in
right, right.
moderation. Everything is in moderation. You can't overload on everything. Also, there's certain foods that are really good for helping to clear
Mm-hmm.
lymphatic drainage, because may I also tell you the difference between lymphatic drainage therapy and lymphatic massage?
Absolutely.
Okay. Lymphatic drainage therapy is the one that is very light, springy,
Mm-hmm.
direction. Lymphatic massage is a little bit like light to medium pressure, and you can do that with someone who's that's undressed to their comfort level. With MLD, manual lymphatic drainage, you keep on your clothes because
Mm.
your clothing will also help you with that springing action. So when people get them confused, it depends on what you want and what your body needs. I will interchangeably go in between, because if someone has a really old scar, I need to use a little bit of medium pressure to break up that scar and to break up that obstruction, to change the viscosity of it. And then I'll go back into the lighter springing action. So it just depends on what the body needs. But I do know the difference between the two, and I may float between the two. And I
Mm.
also teach manual lymphatic drainage therapy with MLD International.
That's fascinating. Now I know a lot of peri and postmenopausal women suffer from bloating and water retention. How can massage help the fluid build up and reduce that discomfort?
Because you're helping to reduce the amount of lymph, remember protein, viruses, even long hauler COVID, and you know those symptoms.
Mm-hmm.
Really makes you lightheaded, it makes you lethargic, it makes you weak, fatigued, bloated. If we're getting rid of the lymph, that means the bloat goes down, the fatigue goes down. And that's how lymphatic drainage helps you. Remember, well, no, you can't remember because you didn't know. I'm sorry. Uh, when you're actually doing lymphatic drainage for the entire body to
Mm-hmm.
actually speed up the rate of lymph that is being processed out of your body from the heart to the digestive system, it's going maybe 10 to 12 beats per minute. After a 45 to maybe an hour session of lymphatic drainage, it goes up to 110 to 120 beats per minute, which means it's processing faster because it's thinner. You need movement to move the lymph because it's a non-autonomic system in the body. We talk about circulatory, that's autonomic.
Mm-hmm.
It's going to move wherever. Your heart's going to beat wherever. Pancreas, your gallbladder, all that's moving automatically. But the lymph system, It needs movement. And think about all our 40 to 50-year-old menopausal, then you have the perimenopausal. They're not moving as much. If they slow down, they may be on the couch for 10 to 12 hours. Well, once you're sitting there, that lymph system is not moving either.
It's sitting there
So
too.
it's sitting there too, accumulating waste. And if you're eating the wrong foods, that adds to it. And eating a lot of sugar, it likes sugar to expand,
Ooh.
just like fat, like sugar to expand. Your pancreas does not. So think about that. If your pancreas is not working well, it can increase sugar spikes, insulin spikes. So you have to work with your body the way it was designed to work for you. And if you don't understand, you are a temple that needs gardening, it needs maintenance, it needs you to help it function correctly. And 8 years ago, when I decided, no, it's actually 9 or 10, I decided, look, I got to be more zen. I got to concentrate, focus on getting myself healthy. And I knew in my massage therapy, uh, my classes, I said, these are the two I want to do. And that has been my focus ever since. That's all I study, my certifications, research, that's all has been about how I can actually move this fluid, calm the central nervous system. And that's one thing I do as well.
Hmm.
Once I do an initial flush of your body, then I calm the nerves because I find that is lymph around the nerves. So, so once I get the nerves calmed down, I'm sweeping again. So it's like lymph,
Okay.
cranial sweep, lymph, as much as I need to get that fluid down, and your body is moving adequately. And I love the fact that I have a few Alzheimer's patients that
Oh,
are,
beautiful.
yes,
Now, for
and
women who exercise regularly, but they feel like they're not recovering well, how might lymphatic drainage help reduce the muscle soreness or fatigue that they are experiencing?
a lot of women who exercise a lot, and I'm looking at you, you are so physically fit. You probably don't have a lot, but you do have some inflammation. It depends on the weakest part of your body where it may settle. It could settle right at a joint. But if you start sweeping that, if we're here on the hip, we're going to sweep towards the adrenals now. There's always a highway. If it's here, we're going to have to bring it up because that's proximal to
Mm-hmm.
this.
Mm-hmm.
Excellent. So that's if that's what they're feeling, but it could be diet as well. They could be overeating the wrong foods, thinking that I look good, I feel good, I'm going to eat whatever I want because I'm going to work it off. It doesn't work that way
Mm-hmm.
because it can still get lodged in your body. And remember, if you're eating the wrong foods, do we know if it's the preservatives? Do you know what preservatives are in your snack foods that you're eating? And also the amount of plastic. If you're cooking with plastic, eating on the plastic plates, eating with plastic knives and forks, you're actually getting some of the molecules from the plastic that will lodge in your body. You may look good, feel badly, but do you really know? Have you had a great detox? Lymphatic drainage is really good for detoxing the body.
That's amazing. What are some of the common signs of a woman's lymphatic system that it might not be functioning optimally, and how can regular massage help with that?
Regular massage will relax the muscles.
Mm-hmm.
Deep tissue, and a lot of massage therapists like to really go deep or use an elbow. But what you can do is end up bruising the muscle belly
Mm-hmm.
because it's the tendons that connect to the bones that stretch. The muscle belly sometimes is not the culprit, but a lot of massage therapists think so. And if you don't have a feeling for touch, you just want to do a rub and done, that that may not be exactly what the body needs. I know
I
for me,
did.
I don't do Swedish or deep anymore because I want I notice that the joints move better once I have cleared those glands first. And then I'm able to sweep the fluids that may be lodged in your thighs, on the sides or your back of your knees. And as I said before, it depends on how the doctor cut you surgically. When if you have a hip replacement or a knee replacement, um, and a long time ago, they were cutting people in the back of their necks if they had cervical spine problems, but now they're going into the front. But those lines are still horizontal. So it all depends. They would have to be assessed, and I always refer to doctors. Now I'm referring to the optimal health system doctors because I want to know if they can compare what they're getting with a doctor or what they can get with a functional medicine doctor. He's going to have a different protocol, he's going to have a different diagnosis. And people need to know they're out there, they can help you. But until I get a report such as that, then I'll know how to treat somebody on my end and then refer back.
Wow, that this is fascinating. For women who are dealing with conditions like lymphedema or poor circulation, what role can lymphatic drainage massage play in managing these issues?
It will help move that fluid and the fat
Hmm.
through highways and side highways out of the body through the adrenals. And matter of fact, when it comes out as urine or waste, fecal matter. So that's how you get it out. You got to poop it out. And and a matter of fact, the lady that I had just yesterday, she weighs almost, I guess, about 280. And I said, okay, did you poop? And she said, about 8 times. Yeah. Can you imagine how much waste is still
Oh,
lodged in your intestines? It blocks, it slows you down. You get bloat, you get belly weight, everything backs up. You're belching. You got you're in your esophagus. Matter of fact, you can get GERD
okay.
because yeah, if you're eating too much food, it's gonna back up, and then you're burping all the time. You can't
Hmm.
eat too late. I know that as I've gotten older, I at 66 years of age, I cannot eat past 5 o'clock. It used to be 7, now it's 5 because
Okay.
my metabolism is slowing down. If I lay down on the food, then it's sitting there. So
Yes.
it's going to cause you more problems. You're going to get up sluggish. You're going to feel like I'm constipated. How am I going to move this stuff? You can move it with lymphatic drainage, but you have to eat healthfully too.
Right, right.
And
And
when
you mentioned that the lymphatic system is the body's toilet. And when I heard you say that, I was like, oh my gosh, that is so true. Can you expound a little bit about that?
Yeah, well, after you've activated it, you've turned it on, you've kind of turned the lever. Then, when it goes through your liver, it's processing faster. It's pumping out of your body. And I've had people call me on the road. I didn't make it home. I'm at a gas station right now. Once it starts losing, once your body starts releasing it, it's a process that you don't want to let go. You just have to know that the body needs to get rid of what it doesn't need. It
Right.
doesn't need all that fat, the fluid. You have to drink a lot of water. And that's another thing too. I tell people before you get to me, I want to have do lymphatic drainage at least 24 to 48 hours. Get your doctor's approval. That is if they're having surgery before, and I want to see you at least in 3 to 5 days post-op because it helps reduce the amount of scar tissue that forms because your body's already operating at getting rid of a lymph and toxic waste, the proteins, the viruses, the bacteria. It's already pumping to get that out of your system at a faster rate of 110 to 120 beats per minute. So if it's working for you to pass the toxins out of your system, your body will heal faster. And so if women want to get it out of their system, Periodically, you need to have it at least once a month. But I tell them to drink cucumber. You can put it in your Ninja or your blender. Cucumber, ginger. These are all anti-inflammatories. Uh, Cranberry, your
Mhm.
citrus, like astringent grapefruit or mandarin orange. Those are your red grapefruits or your red mandarins. You
Mhm.
can and bromelain in pineapple if you're not allergic to it. That's an enzyme. Enzymes are going to help change the pH of the lymph. It's also going to help move it through your system faster. So I make sure I had strawberries, a little orange, and pineapple. I had that this morning. Then I
Okay.
had an apple today. Apple's not really big on my list, but I like apples.
Right.
But
You know what they say about an apple a day.
I know,
It's
but so far,
also good fiber.
yeah, it is good fiber. And notice, fiber, pooping, get it out of your system. And the body will retain what it needs. It doesn't need all the excess. As we get
Right.
older, you don't need all that food. We had workshops at OHS about fasting. And if you think about it, break your fast is breakfast. But you don't have
Breakfast.
to do it at 6 or 7 in the morning. You can break your fast after 12 hours
Ex-
because your body is working to repair itself. And
mhm.
another thing, too, your body or your brain needs at least 6 hours to get into the delta range. So it starts the cleansing process, the lymphatic brain cleansing process. Your brain has to drain too. So, because we want to keep our brains, we want to be able to talk coherently to someone about our bodies, about our health, about what we think, who we are, not just today, but later on. Let's preserve the brain so it can function better and we'll know what we're doing.
How can women do this self massage to know that their bodies are that their lymph is draining optimally? Um, yeah, how can we know that? And if it's not, how can we self massage to get that lymph moving again? Or is that something that we would have to come to a therapist for?
I would like to see them come to a therapist occasionally,
Hmm.
but in between, you can do the steps yourself. And I'm working on an app
Oh,
so that
great.
right. So people can plug in and they can do it with me themselves so that they can live healthier lives. But one thing I'll tell you, and this is a little test too, I want you to take your hands, put them on your thighs.
Hmm.
Okay, start at your knees. I want you to just drag up.
Up.
Uh-huh. You're going to
Okay.
go to your, right here at your
Okay.
panty line. You're going to drag right there. Just drag up there. Now, you may not feel any bumps there, but a lot of women do. Now take your hands on the outside, which is your lateral side of your knees.
Hmm.
You're going to drag same way, a little bit inward towards that panty line. Do you feel any now? Take your fingertips. Now I want you to do the same thing. Now drag up. Feel a little few bumps in there?
Well, not me.
Yeah. So you're
Mine
smooth.
is kind of hard.
Okay. Well, you're perfect. For me, I feel a few little bumps in there. So that
Okay.
means
Now, I was
no, I'm
feeling some
looking at
cellulite before I started training.
well, well, then it would be some lymph in there.
There you go.
Yeah, and if you feel that, they're just that you'll know that you're going to have
Mm.
to glide and spring. That's one
Okay.
way of finding out because I knew about 4 years ago, I noticed that my left thigh was larger after I had an accident. Left thigh, not my knee down, just the thigh because I was hit in my hip. And I
Okay.
realized I've got to start doing lymph on my legs. And I noticed that uh, maybe around a palm size up, there was a protrusion, which means there was a blockage.
Hmm.
If my lymph vessels couldn't get beyond it, then this thigh was going to stay swollen. So I concentrated more on this left thigh to make sure that I was moving that fluid towards my guinal glands to get it out. And today, my thighs look the same size and there's not another hump in there. But that's knowing your body and
Right.
looking for it. If you're
Yeah.
not looking for it and you're looking, a lot of times women want to find all the answers from a doctor when your body is telling you what to look for to be healthy.
Right.
And
Right.
wish they would zone in more on themselves. Don't be afraid to question what someone has told you
Right.
about you. And don't be
Exactly.
afraid of all the medications, because if you have several doctors giving you several prescriptions, we don't really know, and they don't know either, if there it's a contraindication to one medication, too much. My sister-in-law talked to my brother. He says she's on 3 high blood pressure medications.
Oh
Why?
no.
Okay.
Right.
Why would she be on 3?
Yeah.
Ask a doctor why. Don't settle for everything they tell you. Be a part of your healthcare journey. And if you're
Yes.
not, it can exasperate into something else.
Yes, yes, yes. I totally agree with you. And um, with you, when you go to the doctor, you have to tell the doctor what's going on with you, and so you have to know what is happening. You have to be able to articulate that to the doctor, and then the doctor is going to go based on what it is that you tell them. So
Mhm.
it's you really have to know your body, and unfortunately, well, fortunately, which is what we should do. We should know our anatomy, and so we can be able to have a really cogent conversation with this healthcare professional who is licensed to help us. Now,
Mhm.
another question: you showed us how to find to massage our legs and around our face and our neck and the clavicle area. How long do the lymphatic drainage sessions last? How long do the effects of these exercises last?
2 to 5 days,
Okay.
because it starts to slow down from the 120. It starts dropping every day. But if we're increasing our physical movement productivity,
Hmm.
then it can stay at a level of like 150 to 100. It can. It really needs the body to move. If it's non-autotomic, you got to
Hmm.
move to make it move. And another thing I just wanted to add about conversations that you may have with your doctor. Please, women, do not tell your doctor, "Oh, I'm doing fine," and you're on 6 or 7 medications.
Right.
"Oh, I'm doing fine.
Right.
Oh,
Right.
pressure's fine when I'm taking all my medicine. My heart feels good when I'm taking all my medicine." And remember,
Exactly.
my back feels good because I had 2 cortisone shots. And after a while, I don't know why these cortisone shots don't work. But after a while, it starts to deteriorate the cartilage, depends on where it is. So
Hmm.
if you're getting all these shots and it don't work, but you want another, you got to start thinking, is this logical?
Right.
You can't blame the
Exactly.
doctor for not understanding the logic of your conversation about your health. Think, people.
Exactly.
Think, women.
Exactly.
That if
That's
you have nothing else to say to a woman about menopause, think. Is your health, is your body, is the only one you've got? Start
right.
thinking how you're being treated, who's treating you, and what your body is saying to you.
Absolutely. Absolutely. I I so agree with you. You have to let them know. And because you're on medication and you're feeling fine, That doesn't mean that you're fine.
Right.
It
You're
does,
not fine. You're not fine.
it does not mean that you're fine. It really does not. Um, Now, hormonal shifts, because there are a lot of women who are on hormone therapy, but even during the perimenopausal stages, your hormones begin to shift and they lead to more inflammation. We talked about that earlier, and even digestive sluggishness. How does lymphatic drainage help the body process waste and reduce that inflammation?
Well, it's processing the waste because the liver is processing the weight out of your body, the waste out of your body.
Mm-hmm.
But when it comes to estrogen and progesterone, when you're going through menopause and peri, those reduce, and those are hormonal. And if you need those hormones to actually help you process waste a little bit faster, that's not their primary, but it does actually help. But if you don't have that assistance, your body tends to swell. Because I know for me, I did swell. After I had my child, my one and only child, I was 41 when I had my child. People told me, no, you can't do that. But as my hormones were reducing, I didn't have anything to really help me get the waist weight off of me. I was huge. People thought I was having triplets. I mean, my
Wow.
whole face expanded, and he was only like 6.5 pounds. Yeah, I had nowhere to go because my estrogen and progesterone, they were almost gone. And so, therefore, it really was hard for me, even when breastfeeding, to get rid of that weight. I got rid of some of it, but a lot of it stuck around. So if you know that you don't have those hormones in you to help you sleep better, because you can gain, I meant gain, but lose more weight if you're sleeping better, you're not getting up sluggish, your body is not in a state of just barely moving. And remember, autotomic, always go back to that. You got to make it move if it's not moving on its own. And I couldn't move very much. So therefore, I didn't have the hormones to help me move. I just blew up.
How much
And
should we move?
when you're every day, you need to do some type of movement
Well,
every day.
okay, so the rule of thumb now is 10,000 steps per day. So are you recommending 10,000 steps per day? Should it be a brisk walk? Should it be a stroll? You know, or because a stroll can get the can get you moving. So, and then there's a lot of conversation around walking. When you're walking, you should be in like a zone 2, which is kind of it's not necessarily a stroll, but it's not a brisk walk either. So what do you suggest in terms of movement, and does it have to be even walking?
It can be any kind of movement. But if you're
Good.
talking about cardio, it's the walking. But
Okay.
you need at least 15. My doctor told me I need to do at least 15 minutes a day.
Okay.
And he's given me exercises. There's certain squats I can do. There are exercise, but it all depends too, because when my clients come to me and they want to know about moving, I want to get those joints. I want to get those moving first. So I may do a pelvic tilt if it's their lower back. A pelvic tilt first and then a squat, because we have to get the body mechanics working first before
Yeah,
you on a sprint, you take off walking, because sometimes walking is too hard for a person too.
that's
It
true.
just depends on where they are. And I have one guy who may be running in the Boston Marathon, totally different.
Okay.
He's
Yeah.
already got his regimen going, but he swells too after a run because the body, constant force, there's a torque, equal body weight hitting concrete or pavement
Right.
tends to compress you. Well, when he comes, I'm stretching and decompressing, but I'm sleeping. So the
Hmm.
technique is a little different. We do active assisted stretching. I'm always going to do what the body demands because it's not based on me and where you are. We'll start from there. But if it means we're going to do light stretching first, okay, let's do it. If your body can support it, then we're going to walk. If you can't, we're going to stretch. We're going to do a few exercises first to get you into it. Everybody is different.
Yeah.
Everyone can do the same exercise. And I know we have Gilroy saying, do this, do that, do this, do that. Well, you may not be able to do that yet. All right, slow,
Right.
just slow down a little bit. Let's figure out what you can do first. Let's talk to a personal trainer or talk to your doctor. I get sheets all the time, protocols, and they'll say, okay, I want them doing this. That's fine. I work
Hmm.
very closely with doctors, and also when I do I scribe on my notes, my case notes to the VA. I tell them what we're doing, why, how, and I just like to say with one of my dementia uh, patients, or he's a client, I love the fact that we're doing the brain health exercises. And when he has his cognitive response with me, he was able to, the first time after 8 visits, tell me it's in my back. My hip hurts. He's 87, not 82, 87. It's my hip. I said, how does that feel? And what I'm doing is releasing the coccyx
Hmm.
so that it's called an erector. Erector, it helps you go up and down,
Hmm.
hold the body straight, the erector spinae. I'm moving that coccyx there, releasing pressure above the hip. And so I said, how does that feel? Better. Okay. He was able to convey to me that I was helping him relieve and release the pain. It's documented with his family, they were there. And he was able to count to 20, both legs, both arms, moving every part of his body with me to help him feel better.
That's
And,
amazing.
and he said, what are you doing? No, she said, Daddy, what are you doing? He said, she's working on my brain, helping me feel better. It's
Oh,
like
that's
that
beautiful.
moment because our women can be like that too. Because
Yes.
you don't want to lose your brain. You don't, because only 5% of the population could get a hereditary Alzheimer's diagnosis,
Mm.
but most of it is environmental and food.
Yes, yes. I have known that. Oh my gosh, I'm so glad you said that. And also, I just want to share that we've talked a lot about the physical benefits of lymphatic massage, but how can it also improve our mental well-being? And you just touched on it, so can you expound on that a little bit more?
Well, if we have our mental faculties about
Hmm.
us, it allows us to think more clearly and understand that we need to exercise and move and eat adequately, sufficiently, in order to live a long, healthy, meaningful life. And that's all mental. There have not been a lot of studies on, uh, I know this gentleman had PTSD, so
Okay.
therefore it's helping with that. But remember, losing your brain or your ability to think or to speak coherently is trauma. And the
Yes.
body, it will manifest in the brain, but notice it also affects the body, just like it affects his lower hip. So if he is unable to move, and if that leg is contracted, which means he can't move it well, there's an eversion and
Mhm.
inversion where the foot goes out, foot goes in. Your body starts to morph into different positions if the brain is not telling the rest of the body how to move. So if you're full of lymph fluid, remember what it's made of: bacteria, viruses, cellular debris, waste, and protein. If you've got all that in your brain, that stops the flow, the circulatory system from working and flowing through the brain, it can dry out. And if you're not drinking enough water, and it can't get to the brain. It can dry out. I noticed that my gentleman, he is breathing a little bit better, but it's shallow breathing. If you don't get enough oxygen in your circulatory system that goes to the brain, it will dry out.
Mm.
So it works in concert together. So you need the water, the blood, and the oxygen. You need that
That's
that trinity is working.
that's so that's so important because as we age, you know, we tend to deny the thirst. We tend to not drink as much water because we don't want to have to go to the bathroom, several times throughout the day. I mean, even it doesn't even have to be those of us who have aged, who are of a certain age, but even people who are sitting at a desk for several hours of the day and who don't drink water, and we want what there's so many of us walking around dehydrated. I'm so grateful that you said that because we're comprised of 70% water, and so I really am grateful that you explained the importance of water, not only for flushing the impurities from our system, but also feeding the brain as well.
Yes, and think about it. If we're 70% water and we're losing it, we have to replenish. So,
Yes.
and we have to replenish with the purified water. I have a purification system over my in my entire house. My brother said I was crazy, but no, I want to wash in purified water. I want to drink purified water because I don't know what I'm going to get elsewhere. And I eat a lot of plant-based foods and now plant-based nutritionals. And I noticed that only in the past 2 months, by switching wholeheartedly to the plant-based supplements, I feel differently. I do. And I like how I feel, but it gives me more energy. Um,
Yes.
Another thing I wanted to add to, I didn't want to forget, um, women, please take care of yourself and not listen to anybody's definition of you and who you are. Because it's very important that you know yourself. Because once you know yourself, you can be whomever you want to be, but you have to be cognizant of what your body needs in order for you to be whomever you want to be.
Oh,
And
thank you.
yeah, you it's so much that is ahead of you. And don't think it's the end just because you're going through menopause. The body will adapt and you just have to adjust to it.
Yes. Thank you so much for that. Now, for someone who's new to lymphatic drainage and lymphatic massage, what does a typical session look like and feel like?
What it looks like I said, the difference between lymphatic drainage therapy and which is MLD, manual lymphatic
Mm-hmm.
drainage, or lymphatic drainage massage. One can be done with your clothes on, and it's very light. You go through a protocol of clearing the drains, the terminus first, and the drains. And you start at the head. Um, these are your guinals under your underarms, and you're coming up. These are highways right here. Then you're going to clear the inguinal glands because these are axilla, then inguinals. Then I'm clearing your popliteal, and then at your ankles, everything's coming up here. You go to, I try to clear my drains first. I clear my terminus first, then I start on my head. And also, when a person is lying down in my hands, I actually at at the base of their skull, I kind of transition in. I kind of cheated. I transition into the cranial sacral and see what their rhythm, their biorhythm is doing. And people tell me my lymph drainage is a little bit different from others they've had, but boy, it is effective. I must say, I'm so grateful to God that it is effective. I want to know how that biorhythm is flowing. And actually, the head will show me, it'll either shift and stay to the left or to the right. And I know at a 35-degree angle or 50-degree angle that it could be an obstruction somewhere under the scapula or in the rib cage. And I'll go back, check that out. And if there's an obstruction, 99% of the time it is, I will clear that and I'll go back to lymphatic drainage.
Mm.
But like I said, from head to the toe, and then I come up again, head to the toe, so that I'll know that I've cleared this person as best I can in one session, and we can move through very quickly. And I will share with you before and after pictures of some of my work so people can see there is an alternative. Just because the scar tissue is 5, 10, 15 years old, it doesn't mean that the fluid underneath that could have crystallized can't be released and moved back into the lymphatic system.
That's important to know because scar tissue, we don't often associate scar tissue with pain, and to know that the scar tissue under the skin can cause us pain and can be released. That's extremely important to know, and to even it's a part of knowing your body first of all, especially if you well, we know that scar tissue accumulates from an accident, but are there other ways that scar tissue can accumulate under the skin?
Sure, if you have a force, blunt force,
Mm-hmm.
say for instance, with someone's elbow in massage and it's bruised, then your white blood cells are going to crowd in, it's going to protect it, and then you have the makings of the skin that's injured and the bruising, dry blood underneath the surface. That can be surrounded by a lot of inflammation too. So it has to be cleared. It depends on the level, the depth. It takes a long time for it goes through those four phases of a bruise. But once it starts turning yellow, if it was superficial, then you can probably get away with it. But if it's a blunt force trauma, it may be a lot more damage because there are several layers even to get to your wound of tissue. It depends on how many layers of tissue it were damaged. And if the lymph vessels were injured or damaged, they're not going to go back together again as easily as you may think. And you'll notice, excuse me, a lot of women who have your tummy tucks going from hip to hip, and that's a horizontal cut because of the scar tissue is there. Maybe they didn't get lymphatic drainage. They will get a tattoo to seemingly cover the scar. So
Yeah.
it looks less invasive, it looks less traumatic, but a scar is a scar, whether there's dye in it or not. And dye, being a foreign substance, is still not good for the body.
Right, exactly. Oh, you've touched on so many areas that we just take for granted in terms of like the BBLs and the tummy tucks and tattoos and breast implants and things. Oh, we need to speak about breast implants. So, talk a little bit about that.
When the tissue, I know a lot of women get implants because if they've had cancer, and I understand, but it's still a foreign instrument, and people still have them removed afterwards because sometimes the body will reject it, sometimes not. You may be a fortunate one where it doesn't, but where the tissue has been expanded, you still follow the same protocol to release the tension, and also the scar tissue that actually will develop around those incisions because they have to lift up the flesh, remove the mammary glands, and put it back. And some women, unfortunately, doctors have removed their nipples as well when they didn't want them removed. So it will still flow, and I still use the plucking, the sweeping to move that scar tissue along away from that incision in the same way that I do with someone who has lymphedema, who has a lot of inflammation, bloat. It all depends on how severe it is. No, it doesn't. I do the same thing. The
Wow.
body is a body is a body. Tissue is tissue is tissue.
Mm.
If it's diseased, I have to get approval to work on that person. And I don't work on people who are in the midst of chemotherapy. I do wear surgical gloves and a mask. So I'm really a little bit different from your rub and done massage therapist
Yes, indeed.
because that chemo, it radiates from the body. It's radiation or chemo. It's a strong chemical. And so I don't want, if someone is in active chemotherapy, you don't want to displace cancer cells and move them with the lymph to another part of the body.
Right.
That's
Right.
why you get a release from a doctor before you start doing that. And
Yes,
if you want,
absolutely.
yeah, if they're watching, just wait. Just wait
Yeah.
until you finish with your treatments.
Now, Phyllis, we cannot clone you. and and put you in every city in the United States or globally, as it were. But what would a person look for if they are now thinking, oh, I really want to have some, I want to experience lymphatic drainage, or I feel like I need to have this done to me. When they are looking for a therapist, what should they look for?
Interview her.
Okay, and what are some of the things that a person would ask?
Do you have to tell them your symptoms first? What your goals are, and if she can work on those goals, and if she can help release the inflammation that's flowing in your body and you helps you feel better. Lightheaded, if you're feeling lightheaded, I want to make sure I've drained your brain so you can think more clearly. You're not dizzy. Now when you get off the table, most people are have a little bit of dizziness. That's normal. And I have water for you, and I have peppermints and sometimes fresh mint leaves for indigestion, and some ginger chews.
Mm-hmm.
um, because I know that as that lymph starts speeding up the flow, you might get indigestion. And so, therefore, you want to interview that therapist, see some of their reviews, find out if they're certified. Sometimes massage therapists will watch a video and say, "Oh, I do lymphatic drainage, and I can do it." And they, because they've come back to me and they've told me I felt worse, because if you go in the wrong direction, you can cause more inflammation.
Mm-hmm.
Yeah, you have to have somebody who really studies it. They You wouldn't believe the number of people that have told me I've had something under my arm 20 years and now it's gone and I couldn't get rid of it. But it's very important that you interview. I have a 15-minute discovery call where people call me and they can ask me questions, but it's tailored to the conversation. And I tell them what I can do, what I cannot, and I'll tell them if they need to see their doctor first. I want them to do that because I love my license.
Yes.
And I
That
want them
part.
to, oh, yeah, yeah, that's very important. And I want them to stay in accord with the plan of care, because that care plan is really important for a person to follow. And once the doctor sees what's going on with their body, they often say, "Hey, we'll keep it up. All right, then come back. It's okay. The doctor approved. Let's go in this direction."
Beautiful. And that that question brought up a couple of other questions, because you said after the session, a person may feel a little dizzy. Well, how would they recognize that, or distinguish or discern that dizziness from the session and vertigo? And
Um,
would you do anything about that afterwards if they mention that they have a little dizziness?
with the dizziness, it's really not vertigo, because
Okay.
vertigo is a different type of disorder,
Right.
because some people have it all the time, and your head is either spinning one way or the other way, and there's
Mhm.
another protocol for that, but that is not MLD or cranial sacral therapy. A little bit of cranial sacral, but not quite.
Hmm.
But when you're just a little bit dizzy, you're just a little bit lightheaded. Remember, we've
Okay.
moved fluid. Yeah, you've moved fluid around the body.
Hmm.
And once it starts to move, it's a different kind of feeling. You got to get your bearings. So you just sit there a while. I tell you, just sit there. And once you get stable, then we're going to walk a little bit. After you walk a little bit, I feel better. Yeah, you will. You'll feel better. And it's so strange because people don't know what feeling better feels like.
Yeah.
Yeah, it's foreign.
Yes.
Oh, good.
Right, right. Now
Oh,
you mentioned several times about the different brushing or the movement of the hands gently across the body. What are your thoughts on dry skin brushing?
oh, I'm glad you asked that too. I had this conversation. I used to sell these little brushes. Every last one told me this is not working for me. So I'm not really the best one to be a proponent or an opponent of it. I don't know because the brushing, it seemed it just didn't have the grip to get the spring on the superficial skin. So I just,
Ah,
yeah. And some people really love it. Uh, it depends on the age. Now, the people who say they love it, they're usually very young and their estrogen and progesterone levels are up here. But my older clients, they didn't get a thing out of it. Nothing moved. So they really something for younger people. But I know it didn't do anything for me. I stopped it about 4 years ago. I gave away the last one maybe 2 years ago. I said, well, you just have it. Uh, I didn't know what to do with it. So I am a touch therapist. I am a healer. I am a God. I know that the energy that He allows me to feel in the human body has been so instrumental in my success that I can't speak enough about the touch therapy. And also, a lot of women in this age, especially after COVID, are alone. Sometimes they never even get touched. Like,
yes,
and you don't have a human touch with a brush.
that's
Uh,
right. Oh,
and
you
once
don't have human touch with a brush.
you need that touch, and
Mhm.
people want to give me hugs. They bake me bread. Uh, I love it. I just it's really great.
Oh, that's beautiful.
I'd done it sooner, but as my pastor told me, only Sunday, he said, Phyllis, you came to this stage in your life when God knew you would. So I will wait for the women to come to that stage in their life when they're ready. But I hope what we've done today is to allow women to know you can shift if you want to. You can shift and flow in another direction when you're ready. And when you're ready, the universe will be there to greet you.
Absolutely. And on those words, I have to just say what a blessing it has been for us to have this conversation today. And I am so grateful that you have given your precious time to us today to talk about this important topic and how it can assist us and on our menopause journey. So thank you so much, Phyllis Nunn. You are a blessing. You are a gem. You are absolute gem.
And thank you, Betty. You are a gem. You said don't do it. I want to see that crown. I want everybody to know this woman has a crown and they put it on her head. It is so phenomenal. You have to see the video and
Oh,
Shelley put it on your YouTube page.
I
But they've got
will.
a crown.
I will. I will put it. I'll put a link to that on in the description, and so people can see what you're talking about.
Yes, I
That
want to
was
see it.
funny, but I appreciate you so much for that. And I thank you everyone for showing up today with me here on Crazy Sexy Menopause. We are coming back. We're back. We're back. And thank you so much for joining us today. If you like this conversation, feel free to subscribe. Go to my email, Betty at Crazy Sexy Menopause, and get my 3 keys to maximizing your life on during menopause. And just come back again, click the notifications bell, subscribe, do all the things so that you can follow all of the information that I have to share on Crazy Sexy Menopause. Thank you so very much for joining me today. And always remember, it is your life. Live it well. Thank
Yes.
you.
Thank you so much. Thank you, Betty.
Thank
And I hope
you.
we'll be in touch. Bye bye.
Absolutely. Bye bye.
Bye bye.